Hi there, welcome back to my channel. I'll be talking on speech therapy today. Speech therapy is a form of therapy, that focuses on assessing and treating communication and speech disorders. Now, speech therapy, helps with improving communication with your child, acquiring language, with correcting, speech sound disorder. Also help with, you know, language therapy. Speech therapy also help with, fluency shaping, voice therapy, oral model exercises, AAC therapy, which is augmentative alternative communication, and also with feeding. So there's a lot that, speech therapy helps with. But basically, for most of the children who are on the spectrum or who are developmentally delayed, speech therapy can help with a lot of that. And with Daniel, you know, at the initial, when he wouldn't eat food, he would not eat some food and will reject, basically most of the food that you offer to him. So I was referred to contact the Children's Hospital for a feeding therapy. Which was basically done by a speech therapist. So they helped with any type of texture of food, like yogurt, like crackers, like chips, any type of food. So that is what, one of the things that speech therapy helped, with. Another thing that the speech therapy also helped with was, I mentioned that he regressed at one point. So we had an outpatient speech therapy whereby I would take Daniel to like a hospital setting. It's a clinic actually. I will take him there, and then he will, sit down with the speech therapy in a room in a, it looks like a setting, like a classroom. So it will sit there and it will do a lot of activities to help him to communicate with, in all settings in his daily routine. So speech therapy also help us with one of the strategies that I also use as a practitioner, which is gesturing. Because when some kids, who cannot verbally communicate with you, then they also find alternative form of communication for them to use. But with Daniel, the speech therapies, apart from working on, feeding disorder, the speech therapists also work with Daniel with using gestures, so that is able to at least communicate, what he wants. Over the years, after we've been attending speech therapy, because Daniel lost, a lot of words, we were looking for the speech therapist actually came up with another, I would say strategy like PECS. That is what we call picture exchange communication system. So with this one, you have like a board, something visual, a board, and then we will take pictures of the fruits, of the kind of food, of drinks, of anything around us in the home that Daniel likes. So we'll take a picture of that and then put it on, on a Word document, and then print it. So after printing, then we'll put it on our refrigerator so that Daniel is able to, point to what he wants, and with that, it helps with his behavior because it knows that if he's able to point, he's going to get what he wants. So speech therapy is something that as a parent is good for you to look into, and will, support your child, help your child to be able to at least express themselves, if not verbally, at least with gesture or with other alternative form of communication. I hope this was helpful. If you have any questions, please feel free to reach out to me, and I will see you in my next video. Please share, like, comment, and subscribe. Have a great day. Bye bye.